Failure is not an option. That's the message from Deputy President Paul Mashatile in the fight against TB. He was speaking a short while ago during the World TB Day commemoration in Rustenburg in the Northwest Province. Mashatile says significant progress has been made in halting the spread of TB. Our senior reporter Siphamandla Goge is in Rustenburg, joins us now just to give us a sense what were the main messages of Paul Mashatile. Siphamandla, good afternoon. Welcome to today. So I see, according to the Deputy President, people do not complete their treatment.
And that is the biggest challenge in fighting TB, which is one of the silent killers, not only in South Africa, but globally. It's a curable disease that continues to claim many lives. It's something that should not be happening in 2023. Deputy President Paul Mashatile, who is the chairperson of the South African National AIDS Council, stressing the point about the issue of screening and testing, but most importantly, of those who have been diagnosed with TB not defaulting on their treatment, because he says those who are defaulting are at a higher risk of losing their lives. And of course, it's one of the many challenges that many people in South Africa are facing, that they are defaulting on their TB medication. And he says South Africa needs to strengthen its recovery plan in terms of fighting TB. But also remember, TB is not just a disease that exists in isolation. It's linked to social and economic conditions and challenges. Take, for instance, in the region or district of Bujanala, where we are in the Northwest Rustenburg, it is one of the main concerns that many people here suffer from TB. Others have defaulted on taking their medication, and also there is a link somehow, as the Health Minister Dr. Joe Pasha has said, that there is a link between mining and TB. Some former workers who were working in the mines and current workers suffer from TB in this area. The Deputy President saying more needs to be done to ensure that screening as well as testing is vital. Let's please take a listen to him.
Tuberculosis remains one of the leading causes of ill health and death in South Africa. This is exacerbated by the fact that some TB patients do not complete their treatment while others remain missing, which means that they are either undiagnosed or are unreported, even if they are diagnosed. So today, our country joins the rest of the world in observing World TB Day under the theme, Yes, You and I Can End TB. The theme is aimed at encouraging individuals or individual action to strengthen the national strategy against tuberculosis. It underlines the significance of taking personal responsibility and joining forces to eradicate tuberculosis as a public health threat by 2030. We must recommit ourselves to raising greater levels of awareness about the disease alongside the terrible health, social, economic implication, and strengthen other efforts to prevent the further spread of the disease in our communities.
And Siphamandla, what did the Deputy President share about some of the strides that are being made in tackling TB?
Those include the issue of dealing with the health facilities and the infrastructure in the country. But most importantly, today's event, the commemoration of this World TB Day, was the launch pad for the National Strategic Plan, which encompasses 3 areas of focus really, and that is TB, HIV, and as well as STIs. So the Deputy President saying they would need to do more in ensuring that health facilities and infrastructure are better equipped to deal with TB patients. Let's take a listen to him.
SANAC is also preparing for the launch of the Situation Room, a cutting-edge data visualization and analytics platform that provide up to up-to-date multi-sectoral data in an easy-to-use format to support evidence-based decision-making and planning. Another critical signature initiative by SANAC is a continued effort to strengthen the provincial AIDS councils. The core objective of all this work is to pave the way for the successful implementation of the NSP. The NSP 2023 to 2028 calls upon all of us to build consensus and drive a well-coordinated, unified response to the 3 epidemics over a 5-year period. We must also be cognizant of the fact that this is the last NSP ahead of the 2030 target of ending HIV and TB as a public health threat, and we dare not fail. Failure is not an option.
Deputy President Paul Mashatile ending that update there from Rustenburg from Siphamandla Goge.